Hey guys, Seth Peterson here again to talk about a publication in Musculoskeletal Science and Practice entitled Who Writes This Stuff? Information Quality and Authorship of Some of the Most Popular Websites. This was a review we did of the top 15 most popular health websites basically in the world by website traffic. So we used a couple website traffic data collection websites that rank these sites. And then we looked at the top 15. Okay, then we used kind of these standardized metrics to look at the credibility of that site. And those are things like, the date that the website was edited, is that on there? The references, the author, is that clearly listed? Things like that. We looked at the accuracy, comparing it to clinical practice guidelines, using some previously used information. And then we compared it to some of the best practice recommendations that have been out there from a Lin et al. Study from 2020. And the results were probably not super surprising, which is why we had that tongue-in-cheek title. But I think some information that was surprising to me was the authorship of some of these websites. So over half were journalists, and the physicians that were involved in a lot of these websites, like WebMD, make it almost appear as if the physician wrote the site, usually are just an editor in terms of their role. And so that often meant that physicians like ophthalmologists were in charge of low back pain websites. So there wasn't really this matchup between the expertise that the physician or the author might have and the topic of that specific webpage. So you guys can look at that. I think it's also interesting that some of the best practice recommendations weren't really discussed. Limitations of imaging was one that was hardly ever discussed. Encouraging patients to stay at work despite having some pain, something that's recommended in most guidelines, wasn't really discussed at all. And psychosocial factors weren't really mentioned. So take a look at the paper. Again, Musculoskeletal Science and Practice. We're really proud to have this out there. And I think it's a super interesting read if you have a few minutes to do it. All right, thanks guys. Have a great day.